Hi there. My name is Mason, and I'm here to discuss with you this new medication that you have been prescribed for your palpitations and your anxiety. I believe this medication will help improve the symptoms you've been experiencing here over the last few months with your palpitations and your anxiety, which ultimately worsens these palpitations and increasing your heart rate. This medication is called Propranolol. It is a medication that is used to treat a variety of things. It is used to treat high blood pressure, chest pain, also known as angina, heart palpitations, fast heart rate, migraines, and even anxiety symptoms. This medication is known as a beta blocker. Beta blockers are drugs that have the ability to lower a person's heart rate and blood pressure due to their ability to block overstimulation within your heart due to hormones such as epinephrine, also known as adrenaline. We are all familiar with adrenaline here. During moments of high anxiety, your adrenaline levels can spike. This causes your heart to race, which ultimately leads to worsening palpitations experienced by you here. Essentially, this medication slows your heart down and it blocks overstimulation of the heart muscle from hormones like adrenaline. It is important as a patient for you to know that this medication also reduces how hard your heart pumps blood. This results in a lower blood pressure effect. This will be beneficial to you since your blood pressure readings have trended on the higher end over the last year. It has been discussed at numerous appointments between us. This medication is going to come in pill form and it will be swallowed by mouth. You will take it every single evening before bedtime. It is broken down in your stomach, absorbed into the bloodstream, much like nutrients are absorbed from the food that you eat. Your prescription is an extended released tablet. This means it will work gradually inside of your body over a period of many hours. This medication will then be metabolized or processed through your liver and then excreted through the kidneys when you urinate, much like every other medication does. This medication has a half-life of about 8 to 10 hours, which simply means that after 8 to 10 hours, the medication is no longer present within your bloodstream and no longer has effect. This is why you will take the pill once a day at bedtime every single day. It is important to note that consuming alcohol is not recommended while taking this medication because it increases the effects of propranolol. So I want you to keep that in mind. Like all medications, propranolol does have some side effects that I want to discuss here with you today. Some very common side effects include GI disturbances such as nausea, vomiting, abdominal cramping, and constipation. It can also cause you to feel overly tired, dizzy. It can make it hard for you to fall asleep, also known as insomnia. Once your body gets used to taking this medication, these side effects tend to subside over time, if they are present at all. With new medications, I have to talk to you about some adverse reactions that can occur as well. I want you to be on the lookout for wheezing or any kind of difficulty breathing. Symptoms of low blood sugar like tremors, shaking, fast heart rate, sweating. Slow, uneven heartbeats. Feelings like you may pass out or faint. Any vision problems, blurred vision, loss of vision, weakness, depression, or confusion. These are all adverse reactions that are not very common. If any of these happen to you, I want you to call the office for a follow-up appointment as soon as you can. If you feel, though, like this is an emergency and you must be seen sooner, please call 911 or report to your nearest emergency room. Thank you.